On a chilly March morning, Maya, a concerned mother, noticed her 5-year-old daughter, Lily, had developed a strange purplish rash on her legs and buttocks. The rash was not itchy but looked like bruises. Lily had also been complaining of belly pain and stiffness in her knees. Alarmed, Maya decided to take her to the pediatrician. At Dr. Jensen's clinic, the pediatrician carefully examined Lily and listened to Maya's account of her symptoms. Dr. Jensen suspected Henoch-Schönlein Purpura, abbreviated as HSP, a condition characterized by inflammation of small blood vessels due to immune complex deposition, particularly IgA antibodies. This inflammation leads to a clinical triad of palpable purpura, abdominal pain, and arthritis. Dr. Jensen explained that HSP is often self-limiting but can sometimes affect the kidneys or intestines. To confirm the diagnosis and rule out complications, Dr. Jensen ordered a series of laboratory tests. Maya and Lily were directed to the lab technician, Ms. Rodriguez, who gently collected Lily's blood and urine samples. He reassured Maya that these tests would help identify any complications and support the diagnosis of HSP. The tests included a complete blood count or CBC to check for thrombocytopenia or anemia, coagulation studies including PTT to rule out bleeding disorders, and serum IgA levels, which are often elevated in HSP patients. A urinalysis was also performed to assess for renal involvement, indicated by hematuria or proteinuria. Additionally, anti-streptolysin O titers were checked to see if a recent streptococcal infection might have triggered the condition. Later that afternoon, Dr. Jensen reviewed the laboratory results. The CBC showed mild leukocytosis, a common finding in HSP, and normal platelet counts. The coagulation studies were normal, ruling out coagulopathies. The serum IgA levels were elevated, supporting the diagnosis of HSP. The urinalysis revealed microscopic hematuria, indicating some renal involvement, but no significant proteinuria. Dr. Jensen explained to Maya that the pathophysiology of HSP involves the deposition of IgA immune complexes in the walls of small blood vessels, leading to inflammation and damage. This process is thought to be triggered by infections, allergies, or other factors that increase IgA production. The immune complexes activate the complement system, which contributes to the inflammation and tissue damage seen in HSP. Given the presence of renal involvement, Dr. Jensen advised regular monitoring of Lily's urine for the next few months to detect any worsening kidney function. She prescribed acetaminophen for Lily's joint pain and recommended rest and hydration. Dr. Jensen also emphasized the importance of monitoring for any worsening symptoms, such as increased abdominal pain or changes in urine output. Over the next few weeks, Maya followed Dr. Jensen's advice closely. True to the pediatrician's prediction, Lily's symptoms gradually resolved, and she was back to her playful self by the end of the month. Maya was grateful for Dr. Jensen's expertise.